My name is Ginger Shores, and I'm an assistant professor of nursing at Loyola University Chicago. And I'm here to talk briefly about teaching and practice of what's termed the Stay Safe interruption management strategy. This was done with undergraduate pre-licensure students during a recent study that I conducted. If you look to the top left under Introduction, we know that interruptions are prevalent in healthcare settings and increase the risk for errors as well as decrease task efficiency. If a person mismanages or mishandles an interruption, such as by multitasking or engaging, two of the most common actions nurses and nursing students use when interrupted, this increases the risk for errors. Therefore, experts recommend teaching nurses and students strategies that can mitigate these risks. If you look to the center top, Stay Safe is an acronym that offers various actions one can take to handle or react when interrupted. These actions aim to decrease errors and improve task efficiency. So you can see when you're interrupted, you should stay where you are and stay engaged with the task. Associate cues. So what this means is form yourself a placeholder so you know where to start back after the interruption ends. So you can write something down, you can put your finger in the place you're working. There's a number of ways you can associate cues. Or you could find a natural break to pause. So if I am preparing 5 medications and somebody's interrupting me during, I'm almost finished looking at medication 3, I can finish checking medication 3 before giving them attention. That would be that find a natural break to pause. In addition, evaluate the urgency of the interruption. Is it somebody's walking into the room and telling you that your patient is coding where you actually, you really do have to go right now? Or is it a casual conversation that can wait? The quantitative results from my study, you can see again in the center if you're working your way down. I assessed students' interruption management behaviors 3 times using a simulated interrupted medication administration scenario. So I assessed them at baseline, the pretest, where they all engaged or multitasked in the interruption. I then taught them the Stay Safe strategy and had them practice it. Assessed them again at post-test 1. Most used the strategy. I then brought them back 4 to 8 weeks later where all of them used the strategy. I was able to record when they were interrupted and look at the time snaps. The average time taken to use the strategy was 4 seconds, so not very long. And then you can see in the bar graph at the bottom the different strategies, or the different actions, I should say, that they used. We also collected qualitative data. The students said that the strategy was easy to use and remember, that it increased their knowledge and confidence in handling interruptions, and that they were using it within different contexts. So in conclusion, the Stay Safe strategy was found to be feasible and accepted by the study participants. And now what we need to do is examine its impact on errors and task duration, since that really is the intent of the strategy. Thank you.